Welcome to the TBS Podcast. I'm your host, Blake Quimby, and today we have a TBS student and a nursing director, Kimberly Alexander. Kimberly, we're glad to have you on the podcast today.
Thank you so much.
Tell us a little bit about your family.
Well, my husband and I live in Pattison. We've got a little under 3 acres, and we rescue dogs. So that's what keeps us busy.
Tell us a little bit about your upbringing. Were you raised in that area? Where did you grow up?
I grew up in Katy. I graduated from Katy High School. Then I spent a little bit of time in Dallas at the University of Texas at Dallas, but it was way too cold for me. So went back home, went to Wharton County Junior College and got my nursing license. And then I've been working in Katy in senior living and nursing basically my entire adult life.
So you're a Wharton pioneer.
Yes.
Not many people know their mascot, but it is a pioneer, I believe. So how long have you been in the healthcare industry?
I graduated in 2000. I became a nurse in 2004, so 16 years.
And are you enjoying it?
I love it.
Yeah.
I do.
Wonderful. What does a typical day look like for you?
Well, of course, every day is a little bit different, and that's kind of the fun of the job. But I'll tell you, the majority of my day is centered around patient education, staff education. I spend a lot of time with COVID specifically. I'm spending a lot of time on the phone with families. Families are very concerned about what's going on with their loved ones. And in normal times, families just pop in. They see their loved ones all the time. They come in, we talk face to face. It's been fine. Since COVID, I've spent a lot of time on the phone, a lot. Of course, seeing my residents, making sure that they're getting everything that they need, monitoring for symptoms, following up with the normal stuff. But a lot of time, staff education, staffing, and families. That being said, we're spending a lot of time on staffing right now because of COVID, whereas pre-COVID, somebody has a runny nose, they take a Claritin, they come to work. No big deal. Now, if you have a runny nose, you're out of work for 10 days. So we spend a lot of time trying to negotiate how we're going to have proper staffing levels at all times.
So really, you guys are going an extra step. Even if they have any type of symptoms, what are you calling it? Quarantine? Or what does that look like?
Yeah, we ask all of our staff if you have any of the symptoms from fever, gastrointestinal issues, loss of taste and smell, runny nose, cough, any sore throat, anything. You have to quarantine for 10 days. Wow. Can't come to work. So it's been interesting.
I was going to, what in those days when it's low, how do you handle that?
So I used to stress a lot, and I'm not saying that the stress is all gone. That's not true at all. But I got to a point a couple years ago when I realized that I would always staff, and I would always freak out. I would always stress out, trying to find the staffing. And then at the last minute, somebody would volunteer. Somebody volunteers, and over and over and over again. It's very, very, very rare that somebody doesn't step up and volunteer. And one day I came to this conclusion. I don't know, it was like that inner voice. And I'm like, as much as I love these seniors and I want them to be taken care of, God loves them more. God's going to make sure that they're taken care of. God is going to step in. He's going to provide. And so now it's almost kind of yes, I'm doing everything that I can, but it's also a balance of sitting back and I can't wait to see how God's going to handle this one. This is going to be interesting. And so far, miraculous ways He's provided. It's been amazing. So I've been fortunate. I know worldwide and nationwide, there's been a lot of shortages and there's been a lot. I do not diminish that at all. I can say in my experience, He's provided. So that's kind of how I'm handling it.
Many people right now, many business owners, many directors, just like yourself, they're pulling their hair out going, where can I find people to work?
Yes. Oh, that's still happening. And you can see my gray, it's here. But it's comforting to know He's going to provide. I just have to trust, do everything I can do and trust.
Sure. Yep, trust is the huge thing. And I think trust even now with everything going on, it's like, who do we trust? You know, who do there's so many different conflicting reports, and we'll talk some more about that. Um, but in your industry, in the healthcare industry, really, I mean, you're working in the most affected age group that's really been, affected by this virus. Of course, anyone really can contract it, but really, we're seeing the older generation get it. You know, quicker or more often. What are some advice that you can give to maybe our older generation, our older audience, to prevent or try to prevent this virus?
So with our seniors, so of course my demographic, the biggest thing that I'm seeing is to limit exposure to others as much as possible, but there's that balance because you want to make sure mental and emotional health is being taken care of as well. But what we're seeing is the most successful is people avoiding each other 6 feet, right? So I think the 6 feet number was created. I don't know that it's 100% scientifically proven that 6 feet is the answer, but I can say by social distancing and proper infection control, we're able to maintain very well. I will also say that the sooner you can get treatment, the better. So if you're a senior citizen and you're experiencing symptoms, make sure that your family knows and make sure that you're ready to go if you need to go to the hospital. Because what I've seen is that conditions will change very quickly, very suddenly. And if the proper medical care is received, I'm having an excellent results with recovery. I've had several residents, have symptoms, go to the hospital, test positive, and recover. And they're doing okay, but you need that medical care right away. If you put it off, it's not going to go well. So
Wow, that's so amazing to hear that people are recovering because we're not hearing that. I mean, hearing it here and there in little avenues, but we're not really hearing that story told. And so it's really hard for us to maybe many people to have hope in this time because they're thinking, oh, you get it, oh, it's over. I'm pretty sure,
right.
you
And
know,
I mean, I'm not saying that it doesn't cause mortality.
yeah.
We've had some mortality for sure. But since March, out of all of the people that I've worked with that have been COVID positive, the majority have recovered, both young, staff members and my seniors, both demographics, the majority have recovered.
Wow. So you would say the stats on that are more survival than death on that.
With proper medical treatment, absolutely.
Wow, that's wonderful to hear.
Just in my experience, for sure.
You're on the front lines, Kimberly. I mean, I think that means so much. If you're just joining us now, we're talking with nursing director and TBS student Kimberly Alexander, and she is a healthcare professional. She's in the middle of it, in the grind, as they call it, of this pandemic. And so, in your opinion, this is, I think we've had um, uh, definitely, we've already talked about it, conflicting reports, conflicting things. But in your opinion, is America handling this COVID crisis correctly? What are we doing right and what are we doing wrong?
So that's a great question. And I really have spent some time thinking about what my thoughts are. And I have to say, I don't really have an opinion. I don't know that there's enough data collected. I know that there's some countries that have never shut down anything. And I know that there's some countries that have been tracking their citizens via apps and enforcing quarantine. And I mean, it's been very, very strict. And I feel like America's somewhere in the middle. And so I think it's too early to say. I mean, I know it's a cliche to say hindsight's 2020, but I think we're going to really be able to look back and say, have a lot more information. I feel like we can just make the best decision that we can in the moment, try to be as logical as possible, try to be as reasonable as possible. I do think we're in a very good place here in December where a lot of the hospitals that I've been working with have excellent protocols in place.
Good.
So we're seeing recovery a lot more. I'm seeing it more common now than we saw back in March, because we figured some stuff out. We've got some good protocols. I personally love that people are washing their hands. I'm a big fan of how that's changed in the world. I travel, for work normally, and so I spend a lot of time in airports, and I've always just been very concerned with the lack of hand washing that I've seen over the years. So, and I'm seeing people wash their hands. I think that's wonderful. I think the extra level of sanitation in common places like grocery stores is very good. I love seeing that. But where I feel like some of the things that I see that are not necessarily great is sometimes a false sense of security. You can see I'm wearing a mask. I'm okay with wearing masks,
Right.
but masks are not going to keep you from getting the virus. And I feel like sometimes people think that if I just wear a mask, then I can just go live my normal life and it's going to be fine. And that's not the case. The mask is great for keeping, your saliva next to your face instead of going other places, but it's not going to keep you safe per se. We still have to do social distancing. We still need to wash our hands. We still need to try to think about not touching our face and doing all of those things. That's important. And I can say I'm on this balance here where I don't live in fear. I'm not scared, but I have respect for the virus, and I'm mindful. And I've seen enough people that have gotten the virus that I know it's there. So, some of the reports that it's not as prevalent, like, yes, it really is. But I think the bigger picture is we need to have that level of respect for the disease, because many of the people that get it require hospitalization. Okay. And the hospitalization protocols are great. However, if our hospitals are full treating people with COVID because we're not taking precautions, then what happens if you have a heart attack? Or what happens when you have a stroke? Or what happens if you're in a car accident? We need our healthcare resources. And so if our healthcare resources are so burdened taking care of people with COVID that they can't provide emergency life, care and treatment, that's a problem. So there's this balance of not living in fear, but having respect and being mindful.
Yeah, these levels of safety and sanitation that you've been talking about in our stores and our restaurants, is this something that, in your opinion, that we might see for many years, forever? I mean, what do you think? What are your thoughts on that?
So I'm hopeful that we're going to be mindful about sanitation for sure. I think that it's become so normal now that I think people might actually have a problem if it starts to go away. But then I also think, and I am not an infectious disease specialist, so please, no, I'm definitely an Alzheimer's care specialist, but not infectious disease. But there has to be some mindfulness about overuse of antibiotics and antimicrobials too. Sanitation is good and cleanliness is good, but we do know that excess levels of alcohol-based sanitizers and antibiotic soaps can influence the development of superbugs. So that's also something to be mindful of. Soap is good, but bleach all the time kind of puts us at a risk of developing bacteria that is no longer resistant. So that's another consideration.
Yeah, I mean, it's good to have a little bit of germs laying around there, right?
Right. Just the good, like the right germs. Right.
Just a little bit, no, I understand that. Yeah, thank you for answering that. And we were talking about, masks for just a few seconds here, but I want to talk about that. I know you can't talk, but do they even help? Because I've heard, I've heard senators, I've heard, back and forth with doctors, like, they help the other person. They don't really help you from catching, or only is it the N95 mask? That's the one that is supposed to be more helpful than any mask. But I see people walking around with like these awesome decorated masks, and they have their own little saying on there. So are they helpful? Do they help us really?
I think that they do. And I'm definitely, I haven't dug into a lot of the information on it. Basically because I know, okay, so if I'm standing next to you and you have COVID and you cough in my face, I'm probably going to get it even if I'm wearing a mask, right? So that's the truth of the matter. but the mask is keeping me from spreading my germs on other things. So if, I'm touching something at the grocery store and I'm talking, on the phone, I'm going to be less likely to have that saliva particles going out of my mouth and getting on the things that I'm near. It's not 100% and it's not foolproof, but it's helpful. And, in the beginning, before we knew as much and like while everything was so new for us, I'll say in my home, my husband and I went back and forth on mask, no mask, are we anti-mask, are we pro-mask? And we came to this conclusion that it's like, it is helpful. It can be helpful in a way, but there's also a level of respect for one another, that if I'm wearing this mask when I'm in your company, it's like I'm respecting you.
And that's something that I want to ask you too. I mean, we have people that get shamed for not wearing a mask, and then we have people that that are looked upon. Oh, both ways.
Mhm.
Um, so how can you encourage people today with that to say, you know what, it's okay to wear it. That's what we're being asked to do. But for those that are just on the fence, should I wear it? Should I not? Some are just not. I've seen somebody in the grocery store. He was just waiting for someone to say something to him. And I was like, I'm not the guy. I'm not going to be that guy. But
Right.
you encourage people in that situation, because I know it can be very intimidating. Where's the good medium? So how can you encourage someone with the whole mask issue?
Again, I just go back to love.
Yeah.
If you are against wearing, okay, first of all, if I see somebody not wearing a mask, I'm going to just assume that they have a medical condition that they cannot wear a mask. I'm
Yeah.
not going to say anything. I'm not going to judge them. I'm going to assume best intentions and just let them live their life. I'm going to wear a mask because I think that it is helpful. Even like I get tested for COVID every single week. I've been negative for weeks, but I still wear my mask whenever I'm in public and outside of my home or my hotel room, because that's my second home now while I'm commuting. But I feel like it's a sign of respect for others. And I want people to know that they don't need to fear me, or that, that I will, it's not pleasant, but I will wear this mask because I love my neighbor.
Right.
Um, but if somebody doesn't want to wear a mask, like that's fine. That's okay. I'm not going to get mad or upset. I'm going to love you and assume best intentions. And I think that we should all just choose to choose to love one another and respect one another wherever we're coming from. That's how I would encourage you.
So I want to touch on vaccine for a little bit and just kind of get your opinion. I know there's a lot being said. I was looking at a report from Rand Paul. He had mentioned something, about his family getting vaccines, and he says that I still do not favor giving up on liberty for a false sense of security. And I think that you've actually even said that earlier in our conversation of the false sense of security that maybe the vaccines are hoping to give to people. And we know that we've seen, I think there three vaccine producers are using some different ingredients into the vaccine. So how can you speak to that? How can Christians respond to the whole vaccine topic?
I don't know that we're going to have a common answer. I mean, prior to COVID, we had some very pro vaccine and very anti vaccine camps in America. And so I don't think that this is going to change. I will say it's the results that I'm seeing based on the news reports of, I believe it's Pfizer and I think it's Moderna.
Mhm.
They're like 95% effective of preventing the disease. And I think that that's amazing. It's going to take multiple vaccinations and it's going to be a system. But I don't think any vaccine is 100% ever.
Right.
We still have to be mindful. We still have to wash our hands, stop touching our face, don't cough on one another, have some decent hygiene. But that being said, a 95%, if we could get the majority of Americans vaccinated, I'm very hopeful that maybe 2022 will be a different year for us all. But
So you're thinking definitely another year of just really, really the same protocol, not not much change?
Well, so you have to look at approvals and then production, right? And then the logistics of rolling it out. I think that the government said that the vaccine will be free. Okay, so now we've got to come up with funding, and then we've got to come up with who's paying for the nurses to go out and inject it. Where are we going to be injected? Like, where are the clinics going to be for the vaccinations? Um, there's a lot of logistics. It's really easy to come out on the news and be like, it's going to be free and it's going to be wonderful, but like, we've got to produce it. We've got to, and then I believe that they're still voting over who's going to get it first.
I think that's a big topic. I mean, who should get it first?
I just have my opinion. I think we start with our seniors and we start with the healthcare workers on the front lines, and I have a feeling it'll be the hospital teams and the hospital, and then go into the nursing home environment, and then probably then to assisted living. And then I think Europe just came out with their guidance, and I was reading it, and it looks pretty reasonable, like the tiers of how they're going to roll it out. It looks fairly reasonable, like blending in critically ill and people that have comorbidities and other things that make them more susceptible higher up in the tier process than the general population.
You yourself, are you looking forward to getting vaccinated? Do you think that's something that you'll end up doing, or what do you think on that?
I've resigned myself. Like, I don't think that it's an option. This is a disease that is very widely spread. It's very, it's easily contagious. And, it's one of those things. We do everything in our power to care for these people. We love our residents. We love taking care of these seniors. And it would be very, very difficult to know that if I would have taken that vaccine and I chose not to, and then I got the virus and I brought it in and exposed somebody and they suffered from it, that would be very hard on me emotionally. So at the end of the day, I mean, if it's something I can do to help protect these seniors, I'll do it.
I think everyone from young to old have kind of just given, I don't know, I have a little bit on just watching the news, hearing the news, whether it's for whatever side you're on. I feel like there's no one that you can trust. And I know that we can trust in the Lord. Who are you listening to?
That's great. I really limit my listening. I don't listen very much at all. I do try to catch a few clips. And to be really honest, I choose to check several sources. I'll go from Fox News to NPR. Like, I have no preference in that. I want to hear what everybody is reporting. But I very much limit, I would say 30 minutes or less a day. Hopefully less. But I really try to limit my intake because I have enough stress in my life. I don't need any more than that. But I want to hear, if I can hear the story told from several different sides, then I can come up with my own conclusion. My recommendation, though, really just my personal, what I do for myself, I give more weight to healthcare professionals than I do the politicians. It's very, it's interesting how, people that are in power in our country, I don't know that they always remember that the citizens are listening and that we trust our leadership. And so we have to be the leadership needs to be very careful of what they're saying. And I kind of related it to, I use the analogy of like when a hurricane's coming, I don't want to hear the politician. I want to hear the meteorologist. Like, talk to me, like, come on, meteorologist. And so with a health crisis, I really don't necessarily want to hear the politicians. I want to hear the physicians, but I think the politicians need to be more focused on the logistics of like the operations of how we're like, what's the game plan of how we're going to help support one another and how we're going to roll out the implementation of what needs to be implemented, whether it be testing or vaccinations or whatever that looks like. But I don't think that politicians really need to be talking about COVID as a disease necessarily. I don't want to hear what they say. I want to hear what the doctors are saying.
As we kind of round out our time today, how do you see God at work in you as you minister healing on the front lines?
I've seen some really amazing situations since the beginning of March. I've seen these moments where people step outside of themselves and speak like a word of encouragement that was just so like necessary, but so um, surprising.
Mm.
It kind of came out of nowhere, kind of a thing. And another thing that I've really seen, and I've experienced it myself. So sometimes when you're in a stressful situation or you're in a crisis environment, your bandwidth is so small, you can't really process. And so sometimes it lowers your ability to have compassion or care for one another. And, we saw that like in the news stories back in March with people fighting in grocery stores. Like that's like, so, but in my experience and what I've seen since March, it's almost like my coworkers, believers and non-believers, I've seen compassion expand. I've seen more compassion and more empathy and more, when families are calling because they're worried about their loved ones, and maybe this person's over here working in a very intense, stressful situation in this moment, but they're taking the time to love on the family. They're taking the time to be with them. And it's almost like it's similar to like holding their hand over the phone, which is it's God. That is all the Lord, because that's not human. That's not normal. Our normal response is to be short and hang up and keep moving, But that time that we're spending in that human element, I'm really seeing God come through. And it's been amazing to me to see how much compassion that over the past couple of months, and how it's still going. There's still, we're tired, we are exhausted, but that level of compassion still hasn't failed. And I think that's pretty amazing.
How can we pray for you, and how should we be praying for the healthcare professionals?
I will say rest. From what I've found with many of my peers, we're not resting even when we have time to rest. Our brains are not shutting off. Um, we're having less good sleep. Even when we have time to sleep, we're not sleeping well.
Mm.
I would say we're struggling a lot with anxiety. I know that I've been struggling with some depression because I'm giving myself to work so much, and I'm not being filled with the other things that bring me joy, like my family. I'm not able to receive that as much as I had previously to COVID, prior to COVID. So it's been a struggle, and I know several of my colleagues are struggling in the same way. So praying against anxiety and depression, and praying for good sleep. And I would also say tangibly something that people can do is, if you know a healthcare worker, reach out to them. I know a lot of people tell me, oh, I don't want to reach out to you because I know you're super busy, but it means the world. Like, even if I can't answer the phone, just send me a text and say, I'm thinking of you today. So if you have friends or family that's working in healthcare, just send them a text every now and then, or reach out, or show them that you love them every now and then, because it's very lonely, and it's kind of isolating. I spend the majority, so if I'm not at work, I'm sleeping.
Wow.
And or I'm working, I'm working from home on my days off. I'm working a lot, and when I'm not working, I'm sleeping, and it's very isolating. So I'm giving everything that I can to take care of these seniors, and I'm happy to do it. I want to do it. This is for such a time as this. I have these skills, and I'm on this planet that I want to make sure that I'm doing everything I can to support these seniors, but I need support too. So I've been blessed. My husband has been amazing and really stepped up to support me through this time. I mean, he's always been supportive, but he's been tremendous since March. And my wonderful TBS family. And then I've got some great friends that are there for me, that just reach out. And when they do, it means the world. And I might not get back to them for 4 days, but they're okay with that, that they know that I'm running. But just to read that message says a lot, speaks to my heart.
I know you were in the vocational ministry program. That was your program that you've selected. And for someone listening to that said, "Hey, I want to join in and what the Bible seminary is doing. I want to be a student, or I want to support. What would you tell to them as they're listening today? How would you encourage them to get involved?
I would say look into it, go. My pastor told me about it, and within a week I was enrolled, and 2 weeks later I was in class and learning, and it's really changed my life. I say I don't have the personality where I ponder, philosophical things. I don't question the higher level things. My husband does. He loves to talk about that all day long. I don't. I'm just like, oh, that's the fact. Keep going. So TBS has really challenged me to dig into my faith. I know the Lord, and I love the Lord with all my heart, and I want to glorify Him in everything that I do. But I don't always have an answer to why. I just believe, and I have faith, and I know, and I'm like, let's go forward. And so TBS is teaching me to ask those questions and to have an answer to why I believe what I believe. The professors are incredible. The entire family is incredible. Every single person that I've met at TBS has just immediately been like family. But I will say, just being from Katy, Texas myself, to the level of excellence that we have with the team at TBS is astounding. I've had jaw-dropping moments where I go to meet my professor. So of course I'm going to Google them ahead of time. And I'm like, he's teaching me? Okay, this is going to be great. And I've had a great time ever since. So I highly recommend it.
So we thank you for your time today on the TBS podcast.